Let's just start right there. That one sentence. It really captures the heart of this incredibly difficult experience. It can feel like your entire world is tilting off its axis, and you're the only one who can see it.
But here's the thing. That confusion, it doesn't have to be the end of the story. The whole point of this explainer is to cut through some of that fear and misunderstanding and lay out a clear path from that confusion toward clarity. So let's dive in.
So here's our game plan. We're going to break this down into 5 key parts. We'll start with what it actually feels like, the human side of it. Then we'll get into how to recognize the signs. After that, we'll untangle what psychosis actually is, look at the journey to recovery, and then wrap up by answering some of the biggest questions people have.
First up, let's talk about the experience itself. And honestly, the #1 message here, the most important thing to remember is that if you or someone you care about is going through this, you are not alone.
So at its very core, psychosis is a kind of disconnect. It's when your brain starts having a really hard time telling the difference between what's real and what's not. And this can lead to these disorganized thoughts that feel like a completely tangled mess, making it incredibly tough to just get through the day.
Okay, so what does that disconnect actually look like from the outside? Well, being able to recognize the key signs is probably the most crucial first step toward getting support. So let's take a look at exactly what those are.
And this list is so important because it gets really specific. We're talking about hallucinations, that's seeing or hearing things that aren't actually there, and delusions, which are these incredibly strong beliefs that just won't budge, even when faced with evidence to the contrary. When you start seeing these signs, especially when they're paired with things like paranoia or pulling away from friends and family, that's a signal of a really fundamental shift in how someone is seeing the world. These aren't just personality quirks. They are direct calls for professional help.
Okay, so we've talked about what it can feel like and what signs to watch out for. But what is psychosis, clinically speaking? Let's get the terminology straight, because really, understanding the language is a huge part of demystifying the whole thing.
Right. Here's the textbook definition, and it's pretty direct. Psychosis is a condition, a state of being, where a person loses their connection with reality. And let's be clear, this isn't about being crazy. It is a specific medical state with very identifiable symptoms, mainly those hallucinations and delusions we just talked about.
Now, this is a really crucial point. Psychosis isn't one single illness. Think of it more as a symptom that can show up in a lot of different situations. It could be a one-time thing, maybe triggered by drugs or some other medical problem, or it could be a major feature of a long-term mental health condition like schizophrenia or schizoaffective disorder. Which one it is really depends on the cause and how long it lasts.
And this right here perfectly illustrates the thing people get confused about the most. Let me put it this way. A cough is a symptom, right? But the flu is the disorder. It's the same idea here. Psychosis is the symptom, while schizophrenia is one of the chronic disorders where that symptom is a main feature. So, and this is key, you can absolutely have psychosis without having schizophrenia. I know this can all sound pretty daunting, but there is a clear and structured path to recovery. And it's not about finding one magic bullet, it's about a comprehensive, well-rounded approach to care. This roadmap really shows how it all works together. It all kicks off with a really thorough evaluation to get an accurate diagnosis. From there, medication can help stabilize the core symptoms, which then builds a solid foundation for therapy. That's where people learn to manage and process their experiences. The whole thing is then wrapped up with strong family support and a clear crisis plan just in case. And finally, coordinating with other doctors makes sure any other medical issues are handled. It's a real 360-degree approach. All right, let's wrap things up by tackling some of the most pressing questions people have. We're going to jump into our final section now to give you some clear, direct answers.
This is it. This is usually the first question on everybody's mind. Is this something that can actually go away for good?
And the answer is hopeful, but it's also a bit nuanced. For some people, yeah, a full recovery is absolutely possible, especially if they get help early on. For others, it becomes a manageable condition, kind of like you'd manage diabetes or high blood pressure. The focus then shifts to long-term strategies to make sure they can live a full, high-quality life.
The idea of being hospitalized can be really scary. It might even stop some people from reaching out for help in the first place. So is it something that always has to happen?
The short answer? No, not always. If the person isn't a danger to themselves or anyone else, and, this is important, they have a strong support system at home, then treatment can definitely happen on an outpatient basis. Hospitalization is really for cases where safety has to be the #1 priority. This is such a critical question for any friend or family member. It can be absolutely terrifying to see someone you love go through this. So what is the right thing to do? The guidance here is super clear and action-oriented. First, gently encourage them to get professional help. The key word is gently. Don't be forceful or judgmental. If they push back, you don't have to figure it out alone. You can contact a professional team yourself and ask for advice. And of course, if there is any immediate danger, don't wait. Call emergency services right away.
So, after all of this, the signs, the definitions, the road to recovery, it all comes down to this one essential question. The path from confusion to clarity looks a little different for everybody, but it always begins with a single action. So the real question isn't what is the first step, but rather, are we ready to take it? For ourselves or for someone we love?